Chemotherapy means the use of any drug to treat any disease. It can also be referred to as anti-neoplastic therapy or cytotoxic therapy.
Alkylating agents bind directly to nucleic acid, changing the DNA structure slightly, which prevents chromosomes from uncoiling, and it works in all phases of the cell cycle.
Chemo can be injected into the body directly into the bloodstream, or it can also be taken as a tablet or a capsule.
Antimetabolics mask themselves as building blocks of DNA or substances that regulate DNA synthesis, which causes DNA to duplicate wrong. This works in the S phase of the cell cycle where DNA is copied.
Because chemo cannot tell the difference between normal cells and cancer cells, often chemo attacks normal cells, resulting in hair loss and irritation in the intestinal lining and mouth.
Anthracyclines interfere with enzymes involved in DNA replication. This can permanently damage the heart if given in high doses, and works in all phases of the cell cycle.
The drugs used for chemo are divided into groups based on how they affect the body, chemical structure, and the relationship to one another. Chemo is a systematic treatment unlike radiation, so the drugs travel throughout the body to reach cancer cells wherever they are. Chemo can be injected into the body directly into the bloodstream, or it can also be taken as a tablet or a capsule.
Topoisomerase keeps chromosomes from unfolding into biologically active state. This drug increases the chance of getting a second cancer. Mitotic inhibitors act as microtubules and stop mitosis or inhibit enzymes from making proteins. They can cause peripheral nerve damage and only work in the M phase of the cell cycle. Corticosteroids are used to prevent allergic reaction to other chemo drugs or to help prevent nausea and vomiting, but it can be also used to kill cancer cells, which then is considered a chemo drug.